Let us learn about the blood supply of spinal cord in this video. Before we begin, let us quickly revise the sulci and fissure on the surface of the spinal cord. Along the midline, on the ventral aspect we have anterior median fissure, and on the dorsal aspect we have posterior median sulcus. On either side of the posterior median sulcus, we have posterolateral sulci, which will be along the entry points of dorsal roots. Similarly, on either side of the anterior median fissure, we have anterolateral sulci, which will be along the line of exit points of the ventral roots. In addition, in the upper half of the spinal cord, on the dorsal aspect, we also see posterior-intermediate sulci, which will be separating the fasciculus gracilis from the fasciculus cuneatus on both the sides. Spinal cord receives its blood supply from various sources. There are three major longitudinal vessels. One anterior spinal artery, which will be along the anterior median fissure. Two posterior spinal arteries, which will be along the corresponding posterolateral sulcus. And multiple segmental vessels, which will reinforce these longitudinal channels at various levels. And these segmental vessels arise from the spinal branches of vertebral, deep cervical, posterior intercostal, and lumbar arteries from above downwards. So let us see the blood supply here. These are the subclavian artery. From the first part of the subclavian artery, we have the vertebral artery arising. And from the fourth part of the vertebral artery, we have the anterior spinal artery arising from both sides. The two arteries fuse together to form a single midline anterior spinal artery, which descends along the anterior median fissure. From the same fourth part of the vertebral artery, the posterior spinal artery may arise, or the fourth part of the vertebral artery gives a posterior inferior cerebellar artery. The posterior spinal artery may arise from that artery. In addition, we have multiple segmental arteries. They arise from vertebral artery or from the deep cervical branch of the costocervical artery, or from the posterior intercostal arteries, or from the lumbar arteries, as we said, from above downwards. Both these anterior and posterior longitudinal channels anastomose with each other around the conus medullaris. Now here in a section, you are seeing the anterior spinal artery along the anterior median fissure. We are seeing the posterior spinal arteries, which may form a single longitudinal channel, but more often they form two longitudinal channels on both sides, one in front of the dorsal root and one behind the dorsal root. At each level, the segmental arteries enter through the intervertebral foramina. They go in anastomose with the branches of the longitudinal channels to form the pial plexus on the surface of the spinal cord. They also give ventral and dorsal radicular branches, which will go and supply ventral and dorsal roots. The branch to the dorsal root will also supply the dorsal root ganglion. More often, these radicular branches are small, but at certain places, like in lower cervical, lower thoracic, and upper lumbar region, these vessels are larger and they reach all the way to the anterior median fissure. So when they are large enough to reach this anterior median fissure, they will reinforce the anterior longitudinal channel, in which case we call them as segmental medullary feeders. They divide into anterior ascending and the descending branches and anastomose with anterior spinal artery. Similar posterior segmental medullary feeders are also present, but they are relatively smaller in size. But however, they are more numerous and more regular in their number. The largest of the segmental medullary feeder is called as Arteria radicularis magna of Adam Kiewicz. This usually arises as a branch of one of the lower posterior intercostal arteries, that is from either T9 or T10 or T11, or it may arise as a branch of subcostal or as a branch of first lumbar artery. Frequently, it arises on the left side. However, it may be a branch on the right side. This artery divides into ascending and descending branches. Anastomosis with the anterior spinal artery along the anterior median fissure, and it will take care of the blood supply of almost and lower 2/3 of the spinal cord. The central branches from the anterior spinal artery or the anterior longitudinal channel will take care of supplying anterior 2/3 of the spinal cord. That includes most part of the ventral and lateral funiculi, ventral horn, part of the intermediate horn, as well as base of the dorsal horn. The radial branches coming from the posterior spinal arteries will supply the remaining part of the dorsal horn, part of the intermediate horn, and of course posterior funiculus on their own corresponding sides. The periphery of the ventral and lateral funiculi are supplied by radial branches arising from the pial plexus. So coming to the spinal cord ischemia, if there is damage to the anterior spinal artery, almost anterior 2/3 of the spinal cord will be ischemic, and this gives rise to a syndrome called as anterior cord syndrome. So that will have effects due to the lesion of corticospinal tracts, ventral horns, spinothalamic tracts on both the sides. Involvement of artery of Adam-Kiewicz results in ischemia of almost lower 2/3 of the spinal cord. So this does an important work. Similarly, the mid-thoracic segments are the least vascular because they lie in the junction between the area supplied by anterior spinal artery and the area supplied by artery of Adam-Kiewicz. So whenever there is hypotension, this is the area which undergoes ischemic changes first. Now coming to the venous drainage of spinal cord, the intramedullary veins will reach the surface where they will form what is called as coronal plexus, and this coronal plexus will then drain into 6 longitudinal channels, one along the anterior median fissure, one along the posterior median sulcus, 2 along the anterolateral sulci, and 2 along the posterolateral sulci. These longitudinal channels will drain superiorly into cerebellar veins and the dural sinuses, and segmentally these will drain into intervertebral veins, which will communicate with the internal vertebral plexus as well as external vertebral venous plexus, which will then drain to vena cava system or the azygous system. None of these veins have valves, so drainage as well as spread of metastasis will occur in both the directions. Thank you very much. Hope you enjoyed this video. Please visit this site for similar neuroanatomy videos. Thank you.